right, now I come in the room, identify myself, and ask for 2 forms of identification. And what we're going to do is you get to have this taken out now, so you can try a little food. Apparently, you got all bowel sounds are active. Great. And I think the obstruction has been alleviated. So it wasn't a tumor, but what it was a little inflammation going on there, so you couldn't quite pass things. Since the doctor has had you nothing by mouth, given you some medication, IV, that's taken down that. So we're going to take it out now, okay? Oh yeah, I know you can hardly wait. All you need is a paper towel. You don't need chalks and all that kind of thing. Make sure you unpin. One thing I want to show you. Let's say she had to go to the bathroom before I take it out. She wanted to go to the bathroom. Well, remember I told you would disconnect? Of course, I'd have my gloves on. You want to pinch, because all those secretions it's going to go at the place of least resistance, which would be out. So you pinch, go like this. This can still be suctioning. It really doesn't matter because she's only going to be out for a little bit. Take her to the bathroom. She comes back. Now you're going to reconnect. Of course, I'd have gloves on. Unclamp, should go through, you know you're working. Now what do I have to do?
Push 20 cc's of air.
Now I have to push 20 cc's of air in there. Why am I doing that? Oh, there's a bulge right.
Well, there's a bigger one right next to it.
Yeah, but this is a little slip tip. I can't use him. This is catheter tip. Okay, so why am I going to, now I'm going to put it in the pigtail. Why am I doing that?
To make sure it's not suction.
Yeah, in case it was up against the stomach when I reestablish suction, I want to push it away. That's all you got to do. Now I'm going to take it out. You'd want to use that catheter tip syringe. This is the slip tip or the Lurlock. This is the bulb syringe. You want the catheter tip syringe. All right, so now I'm going to take that out, all right? Okay, my instructions is I want you to take a deep breath and hold it, and then I'll pull it out, all right? Is it going to, no, it's really not. It's not going to hurt. It's just going to feel a little funny. It won't even be uncomfortable. You've been passing gas, right? Okay, that's a good sign. I'm just going to take this tape off. Okay, on the count of 3. 1, 2, 3. Take a deep breath and hold it, please. Now you can breathe. Worry about this later. I'll tell you what we do. Get gloves on. Do some care. Look at her nares. Let her brush her teeth. They just feel gross. And let her brush her teeth. And then she's ready to rest a little. But I'm not done. That's your skill. Easy.
How am I supposed to turn the suction on?
Was the suction on or off when you took it out?
You want to turn it off.
Off, okay.
Yep. If you don't, as you pull it out, yeah, I didn't explain that. If you don't, as you pull it off, then it's suctioning as it's coming
Well, that's
out.
why I was wondering, like,
Yeah,
I should have turned
you
the
turn it
suction
off
but
and
I
then just
didn't
take
know
it
if
off.
You just didn't, but okay.
No,
I
you
didn't want to
turn it
assume.
off. Okay, now what you want to do is you've got all the stuff. And the reason I bring this up is because I remember I went in one time, somebody still had secretions in their suction canister, and I looked to see when it was DC'd, and it was like 2 days before then. This was mold growing up.
Oh, man.
So, you're not done. Throw all this away.
Straight trash can?
Yep, you can just roll it near. Now, you're going to have to do this. I want to explain something. This stays. This never comes in contact with any secretions. Okay, it's just suction. This is the stuff that does. Now, it varies with different manufacturers. You're probably the ones I'm used to. You pop off the lid, and there is a little flexible, like, holder. Like it fits right in. And that's what you want to take out. This stays. Unless it is not, doesn't have an inner liner, and then that goes. But you're always going to look. If you have one that has an inner liner, look at your secretions first. 600. Pop it off. Put it back, because there are no measurements on here. All right, now there are many ways of doing this. It has this little inner canister, so what you can do is you pop off this, and they have what are called crystals that they put in, and it solidifies like sand, so that if it was falling over, it wouldn't drip out. Otherwise, I've seen them falling over with ingy secretions all over the place. Try and clean that up. So that's like cleaning up an egg. It's hard because it's mucousy. So they have these little crystals that you could put in. So do that. Then put on your little caps. Put it in a special bag. Place it wherever they want you to place it. Ours was always on the floor next to the red, because you don't want to put it in the red because it'll sometimes fall over. But if you have the solidifying crystals, that works really well. But that's where we were supposed to put ours. Now, if you ever have to get this ready, which you might, somebody's going to be coming in for the next patient, you get a brand new one if it has a little inner liner. If not, put it on. It'll say vacuum, patient, ortho, and then this is the emptying spout. If you have to empty it. This is the vacuum. This is where you take off for the patient's vacuum. This is the patient. You'd have all this brand new tubing ready to go. So you'd have to get fresh tubing because a new patient may come in. Then you have it all ready for if someone comes in the emergency room or anything. You have everything ready. So you have to know what to get ready. And you're noting the amount, color, and consistency of the secretions. What is in there, how much is in there. You're really not going to, as well as an odor. But if you do have to empty this and it doesn't have an inner container, I'm going to tell you, be careful. Because it kind of blobs up every now and then. So if you're going to pour it into Graduate to measure it, wear something over your face or go like this. Because when you pour it in, it goes whoop. It's just like globby pieces. Sometimes they can be quite large. So you pour them in there and they're in the liquid and they're going to plop up. That's why I like the solidifying crystals. So wear a shield if you're going to, if you're going to empty it. You don't want this in your eye. I don't know what that person has. So that's all it is for you.